Look, the early advice is that we've seen cases in Hong Kong, in Belgium, in Israel, but one of the problems with this highly contagious virus in any of the variants is that it tends to be hidden in the community and then announces its presence when we least expect it. So I think we do need to be all alert. But having said that, even if we are relaxing some of our rules, perhaps this virus just reminds us that if you are, as the Premier has said as late as yesterday, if you are in close proximity to a lot of other people, even though the rules might not require you specifically to wear a mask, the advice is wear a mask. That was before we had the Omicron variant perhaps knocking on our doorstep. So I would strongly suggest that anybody currently in the community who is in close proximity to large groups of other people or very close to them, wear a mask. It's the safest thing and allow us to work through the issues as we've done over the last 2 years. I feel quite confident that our New South Wales health team and our broader Australian health team across all states and territories will be able to handle the issues. But we do need, as we've always had, the support of the community to meet the challenges that will come to us with this new variant.
And Mr. Hazzard, just confirming there's been no tests confirming any of those cases in Australia yet?
I can't confirm Australia, but I don't believe there have been any in Australia yet, Danuta. I can say that it would appear that we've had no positive cases yet in New South Wales, but I would also say that it's quite possible. Whilst we're focused on the southern part of Africa, roughly about 9 countries, 8 to 9 countries, it's also a truism that when people come through our front door at Sydney International Airport, they tell us the last place they've come from and not necessarily the previous places they've come from, nor with whom they might have come into contact at crossover airports. And I know there's one case that I'm aware of in Europe that doesn't appear to have any connection yet to South Africa. In fact, it seems to be a case that connected via Turkey. So again, the advice is just be very cautious. I think we need to enjoy our life here in New South Wales, our return to normal, but with a caveat, and that is be careful. Large crowds, too close together, wear a mask, it's sensible. Thanks very much, Danuta. I'm sorry, Danuta?
Any comment?
You said you had one question, Danuta, and now you've had a dozen, and you didn't even come to the conference. What was the last one, sorry?
About schoolies, the fact that schoolies, you're talking about, avoid large crowds.
Yeah, well, as I said, look, you've got to be practical and sensible. Schoolies are still going to happen. Kids are still going to enjoy the fact that they've got to the end of their schooling lives. But I would just say to those young people, be a bit cautious. Whether or not they take that advice, most young people don't, but it's a good idea to do it. And hopefully, as we know anyway, with each of the variants so far anyway, very few young people have actually had major problems for themselves. They tend to cause problems for their family members. So be cautious, be sensible, but still enjoy schoolies. You've had a rough 2 years. Thank you.